Does everyone really need sunscreen? Everyone needs sunscreen. That means everyone from lighter skin types to darker skin tones. For lighter skin types, we are concerned about skin cancer prevention. For darker skin types, even though they can develop skin cancer as well, we're also concerned about sunscreen working to prevent hyperpigmentation. Most people are not familiar with the fact that there are two major types of sunscreens. There are chemical sunscreens and physical sunscreens, otherwise known as mineral-based sunscreens. I love mineral-based sunscreens. They protect against all UVA, UVB, as well as visible light, computer screens, phone screens, things like that can particularly impact hyperpigmentation in skin of color. That gives that added protection against that blue light or that visible light. How much sunscreen should you use? If you are outside, that means in direct sunlight for 2 or more hours, you should reapply sunscreen every 2 hours you are outside. I like to go by the 2-finger rule. So that means if you take your index and middle finger, spread a thin layer of sunscreen along both, that should be enough to apply to your face and neck. You hear a lot about skincare regimens. I believe that there's a lot of misconceptions. On one extreme, people feel like you don't need one at all. On the other extreme, you need this multi-step 10-product regimen that you need to do. I think the answer is somewhere in the middle, okay? There are a few categories of products that I feel like everyone should have in their regimen. 1 is a good gentle cleanser. 2, a good moisturizer. 3, a good sunscreen. And 4, a retinol. Now, there are some added things that you can, add to your regimen, serums like vitamin C or hyaluronic acid. But I feel like if everyone has at least a good cleanser, moisturizer, sunscreen, and retinol, you're covering most of your bases. Simplicity is a key to consistency. Most people will have too complex a regimen and then they lack consistency. You can always build upon that, but this is a good foundation for a skincare regimen. Is there something that I'm doing that's causing my acne? Acne is a condition that's super common. It is not just limited to teenage years. I see patients every day who have adult acne, who struggle with adult acne. So there are multiple factors that play a role in acne. Hormones are a primary contributor to acne. Diet, including dairy and sugar, can be contributors. Environment can play a role, as well as genetics. Due to the fact that there are multiple factors that contribute to acne, there are varied treatment options to treat the hormonal component of acne, the inflammatory component of acne as well. Early treatment is important to prevent hyperpigmentation and scarring. I know that acne can really impact your self-esteem and quality of life. I want you to know that there are varied treatment options that are available to address your specific need. It is best to see your board-certified dermatologist to determine the best treatment option for you. The number one skin concern in skin of color is hyperpigmentation. Any type of dark discoloration that occurs on the skin, it can present after acne, rashes, bites, and many other things that cause inflammation in the skin. Sunscreen is key in order to prevent and treat hyperpigmentation. In addition, there are many and varied topical options that can be used, as well as procedures, including chemical peels and laser, that may be used to address your specific type of hyperpigmentation. Now, this is a question that I get a lot. How long until I see results from my treatment? It can take a minimum of 3 months, but can take 6 months or longer to see complete resolution. It is important that we treat the underlying cause of the hyperpigmentation in order that the hyperpigmentation does improve. Hair loss. Let's talk about hair loss. This is a condition that affects both men and women of all ages. It can affect your self-esteem, it can affect your quality of life. It can begin as just mild thinning, a widened part. Most people don't understand that there are multiple types of hair loss, otherwise known as alopecia. There are 2 major categories of hair loss: non-scarring hair loss and scarring hair loss. Non-scarring hair loss is where there is no permanent damage to the hair follicle, but there is loss or thinning of the hair follicles. Scarring hair loss is where there can be permanent damage to the hair follicles where the hair follicles do not regrow. One thing that is important to know is that scarring hair loss is a lot more common in individuals of African descent, particularly Black women, and can be preceded by symptoms of itching, burning, or pain. If you experience any of these symptoms, it is vital for you to get treatment and evaluation as soon as possible. Early treatment is vital to prevent further hair loss. Here's what you can expect at your hair loss consultation. When you see a board-certified dermatologist regarding hair loss, what we like to do is a detailed history. The duration of your hair loss, the pattern of your hair loss, the areas where you're experiencing hair loss on the scalp. This also entails us taking a detailed look at your scalp itself. It is important that the hair is free, loose, uninhibited by braids or weaves, and we want to be able to have a clean scalp in order to be able to evaluate it most thoroughly. We may utilize a dermatoscope to examine your scalp. We may do a hair pull test. We may do a biopsy, and we may order blood work to determine if there's any nutritional deficiencies that are contributing to your hair loss. Based on your diagnosis, we will recommend tailored treatment, which may involve oral medication, topical medications, or injections. Let's talk about those small dark bumps that you might have seen around your eyes or on your neck. Very common if you have skin of color. They are called dermatosis papulosis nigra, otherwise known as DPNs. These are benign growths that we see on the skin as we age, completely harmless and never turn into anything of concern. They can be removed for cosmetic purposes. Treatment is easy. We do it here in the office. We use a tool that basically destroys the lesions, and they fall off at home within about 1 to 2 weeks. One of the most popular treatment options in our practice is the Aerolase laser. This is a laser that is safe for all skin types and is used to treat acne, hyperpigmentation, melasma, is used for skin rejuvenation and tightening, as well as for laser hair removal. It is a device that is very well tolerated with little to no downtime. Something that has gotten really popular is one of my favorite treatments, and that is Botox or other neurotoxins. Botox is used to address frown lines, forehead lines, crow's feet, to basically help soften those fine lines and wrinkles in those areas. Some patients do confuse Botox with fillers. Botox, again, addresses and relaxes the muscles in those areas. Fillers are primarily used for areas where you have volume loss. Botox is very easy, it's simple, it's safe, it is affordable. Generally, the treatments are required 3 to 4 times a year. This is something that is a very, very effective treatment. Another treatment option that we offer here in our office for acne-prone skin, hyperpigmentation, or dehydration is the Diamond Glow. The Diamond Glow is a microdermabrasion type treatment that combines exfoliation, extraction, and infusion. There are multiple serums that can be used, including serums that target skin brightening, hyperpigmentation, acne, and hydration. A question that I get asked a lot is, why does my skin keloid? The answer to that is usually genetics. Keloids are basically a growth of abnormal scar tissue that can result after a piercing, a minor injury, a surgery, and just due to your genetic makeup, your skin responds to that injury by creating excessive scar tissue, which creates a keloid. Keloids are not just a cosmetic issue. They can be itchy, tender, sore, and when these keloids are symptomatic, we do encourage treatment. Those symptoms can impact quality of life. The primary treatment involves the use of cortisone injections. The cortisone injections are used to treat the symptoms of the keloid as well to flatten and smooth. Surgery is often used for the treatment of keloids, but only in combination with cortisone injections, because surgical removal of keloids can also create further recurrence of those keloids. What hair vitamin should I use? One of my favorites is a product that we currently carry called Extresse hair gummies. These are a plant-based hair vitamin in the form of a gummy. It's strawberry flavored, so it tastes amazing. And it targets 3 particular things that can contribute to hair loss. 1, the hormones that contribute to hair loss. Secondly, inflammation. And thirdly, cellular aging. Extresse is only available in dermatology offices, so next time you're here, ask us for a sample.